most of the surgical instrument has got three parts. One is the acting part that is known as blades, and there is a joint and the shaft. And some instrument has got also the finger bows. So, there is a ratchet. There is a ratchet which is used to clamp the shaft together so that it can be tightly clamped. These are the main parts. Then blades, joint or fulcrum, and shaft, ratchet, and finger bows. In case of hemostatic forceps, remember, in case of hemostatic forceps, the blade and joint, these two are together almost equal to the shaft. This shaft and this part, it is almost equal. Remember this. Then, what are there are different types of hemostatic forceps, straight, curved, large, medium. The serrations may be through the whole of the blade or through the half of the blade. These are minor differences. These are not very important. This instrument, why it is used? Why? This instrument, as the name is hemostatic forceps, these instruments are used mainly to stop the bleeding from a vessel. Hemostatic forceps are used almost all operations. There are some surgical instruments which are used almost all operations, such as, towel clip. Because almost all operations, we need to drape the area. Towel clip is required in all operation. Then sponge holding forceps, because we have to paint in all operation. Then sponge holding forceps. Then hemostatic forceps, this one, because whenever you cut, there will be bleeding, and you need hemostatic forceps. Then BP knife or BP handle and blade. These are also used in almost all operations. Then dissecting forceps, you have to use in almost all operations. In most of the operations, we have to use the needle holder, because in most of the operations, we have to suture the cut area, but not in all operations, remember. Sometimes we don't suture. And scissor, these are the instruments we have to use in almost all operations. And some gallipot, kidney tray, etc. Now, what are the use of hemostatic forceps? To hold the end of bleeding vessels for hemostasis, to hold the margins of different abdominal layers during laparotomy and closure. We can hold the different layers of abdominal wall, such as the anterior rectus sheath, posterior rectus sheath, the peritoneum, etc., or the external aponeurosis, etc. The layers of the operation, layers of the abdomen during operation and during closure. Splitting of the muscle layers. We can split the muscle layers with this instrument. We can use this instrument for blunt dissection in small operations such as sebaceous cyst, lymph nodes, lipoma, etc. When we suture, Then we can use the free end of the suture, the one end of the suture. We can hold with hemostatic forceps for suturing, knotting, etc. If we don't have the swab holding forceps, we can use it to hold the swab. If we don't have the sinus forceps, we can use an alternative of sinus forceps, etc., etc. There are many uses, but the foremost use is to hold the end of the bleeding vessels. Now, what is this instrument? This is the dissecting forceps. This is dissecting forceps. This dissecting forceps, this is the blade acting area, and this is the shaft, and this is the joint. Dissecting forceps is a third-class lever. It needs very strength and power to act. But dissecting forceps are of two types. One is plain dissecting forceps, or the better term is non-toothed dissecting forceps. There is no tooth here. Though there are serrations, if there is no serrations, we cannot hold a tissue. It will slip easily. But there are serrations, but there is no tooth. There are other dissecting forceps which have got tooth. This has got a tooth. Then dissecting forceps. This is also used in almost all operations. The tooth, you can assume that tooth dissecting forceps are used to hold the tough tissue, and the plain dissecting forceps or non-tooth dissecting forceps used to hold the soft tissue, delicate tissue. This is non-tooth dissecting forceps. We can hold the peritoneum, the intestine, the bleeding vessels, the nerve, etc. with this instrument, because it will not cause any injury to the tissue. But in case of tooth dissecting forceps, the tooth can injure the tissue. Therefore, we don't hold such delicate tissue with non-tooth dissecting forceps. With tooth dissecting forceps, we hold the tough tissue, such as rectus sheath, the skin, etc., skin, rectus sheath, aponeurosis, etc., we can hold with tooth forceps. Then in tooth forceps, there is a tooth at the tip of one blade and groove on the other. The presence of tooth ensures better grip of the tissue and less chance of slipping to hold tough structure like skin, fascia, aponeurosis, rectus sheath, scalp, etc. This is also a type of dissecting forceps. It is action forceps. Then dissecting forceps is another instrument which is needed in almost all operations. Then what are the uses of dissecting forceps? To hold the tissue for temporary period, such as during suture or during cutting. We hold the tissue and we cut just for a small, just for few seconds or few minutes, etc. And dissecting forceps are used to hold the tissue margins during dissection, incision, cutting, and suturing for these reasons. And we also hold the tip of the bleeding vessels for diathermy when we use it to the tissue. we usually hold the bleeding vessels with the dissecting forceps, and we apply diathermy to the dissecting forceps. This is the usual procedure. Though instead of dissecting forceps, we can also use the hemostatic forceps or other tissue. And these non-to-dissecting forceps can be whole and lived, can be used to hold and lift needle during suturing to hold end of the knot while removing sutures. When we suture or we remove the knot, we can use the dissecting forceps. These dissecting forceps are sterilized by autoclaving. Now, what is this instrument? This instrument is known as tissue forceps because we hold tissue with this instrument. Tissue forceps. You see, this is the blade, and this area is carved, and there are some tooth here. And when we hold the tissue, when we fix the clamp, there is some gap within this blade. This gap provides the area for tissue, and therefore this instrument is known as tissue forceps. We hold tissues. This forceps, there are some tools at the end of the blade. Therefore, obviously, we cannot hold the delicate tissue with these tissue forceps. This instrument is not designed to hold the delicate tissue, such as intestine or the peritoneum, etc., or the fat, etc. This instrument is known as Alice tissue forceps. ALLIS, Alice tissue forceps or Alice tissue forceps, or whatever you say. The Alice tissue forceps. This Alice tissue forceps is used. You see the Alice tissue forceps. There is a ratchet, the finger bow, joint, etc. This Alice tissue forceps used to hold the top structure like aponeurosis, rectus sheath, linea alba, etc. Remember, whenever there is tooth that is designed to hold the top structure, because we don't hold soft structure with tooth. For hemostasis from the cut margins of tough tissues such as skull, uterus, urinary bladder, etc. We can, you see, these are all tough tissue, skull or uterus, and we can hold the margin of this tissue to reduce bleeding. Should not be used to hold soft and delicate structure like intestine. It should not be used to hold the delicate structure like intestine. This is another type of tissue forceps. This is known as backpock tissue forceps. You see the end is something like spoon. This end is something like a spoon. This is the blade, the joint, the shaft, the ratchet, and the finger bows. Then this is the Babcock tissue forceps. Remember the difference between this and Alice tissue forceps. This is Alice tissue forceps. The blade is straight and just the tip is curved. In case of Alice tissue forceps, it is almost both of the blades are almost opposed together. Just the end is form a spoon-shaped curve to allow the tissue in between this area. This is the end of the blades are serrated, but there is no tissue. Sorry, there is no tooth. And as there is no tooth, this forceps is used to hold the soft tissue, such as intestine. Therefore, it is also known as Babcock's intestinal clamp or intestinal forceps, but the term is Babcock's tissue forceps. Then this instrument used to hold the soft tissue. Then you see, in dissecting forceps, we have two types of dissecting forceps, plain dissecting forceps and tooth dissecting forceps. Plain dissecting forceps is used to hold the delicate structure. Tooth dissecting forceps is used to hold the tough structure. Then again the tissue forceps. Alice tissue forceps is toothed and therefore that is used to hold the tough structure, and Babcock's tissue forceps is non-toothed. It is used to hold the soft structure. Now, when we use the tissue forceps, dissecting forceps, and when we use the tissue forceps, obviously, you see there is a ratchet in the tissue forceps. That means we have to clamp the forceps, and therefore it is used when we hold the tissue for a longer period, such as several minutes. But dissecting forceps, in dissecting forceps, there is no clamp. Therefore, we hold for a small period, such as when we suture the tissue. We just hold and suture, and again we remove the forceps, and again we hold. Then it is difficult to use this forceps. That is the difference between these forceps. One is to hold for a longer period, another is to hold for a short period. This is another type of hemostatic forceps. It is known as Cocker forceps. It is somewhat like the hemostatic forceps, but you see the forceps is much more stout. It is strong than the hemostatic forceps. This forceps is used as hemostatic forceps, but when the tissues are very tough, then in that cases we use this Cocker forceps, such as the rectus sheath or the uterus, etc. When the tissues are very tough, hemostatic Cocker's hemostatic forceps or simply forceps is stronger and stouter than artery forceps. At the tip of one blade there is tooth and allows very firm grip. It is very stronger than the hemostatic forceps. Suitable for holding vessels within tough structure like sole, palm, etc. Vessels within considerable amount of tissue as in broad ligament. To hold tough structure like meniscus, cartilage, chips, bone, etc. It is used to hold the very tough structure. Then you have understood so far? Yeah? No questions so far? Okay. Then you see this instrument. What do you see at the first side? What do you see? Yeah, there is no racket. That is a very important difference. Otherwise, you can you could say it as a hemostatic forceps, but there is no racket. And there is another difference. uh, The end of the blade is broader, uh, and it is very smooth and round. The end is very smooth and round. It is not sharp. This is known as sinus forceps, Lister sinus forceps. Lister sinus forceps. It is used uh, to open up the abscess cavity, particularly in Hilton's procedure when have we open up an abscess cavity. We use this. The tip is round and smooth, and it is broader. Therefore, it should not injure any major vessels or nerve, etc. When we thrust the instrument bluntly, we, we assume that this instrument will not cause any injury to the vessels or nerve because the end is round, broad, and smooth. Then Lister sinus forceps. It is used to open up an abscess cavity by Hilton's method. This is the main use. To open up an abscess cavity by Hilton's method can be used to hold gauze swab to clean the abscess cavity. But there is no ratchet, and therefore you might slip the gauze. Should not be used for that purpose unless the cavity is very small. Then the use of sinus forceps is to open up the abscess cavity. Just remember this single use, and it is sterilized by autoclaving. So far we have told the instrument, all instruments are blunt, therefore all can be autoclaved. This is sterilized by autoclaving. Now come to another instrument. What is this instrument? You see the difference of the blade and the shaft. The blade is very small in comparison to the shaft. In hemostatic forceps, we told that the blade is almost equal to the shaft, but here it is small than the shaft. Shaft is very long. The blade is very small, and the blade is very stout. And there are also other differences. You see the blade, there are serrations, which is crisscross serrations, like this. Not a longitudinal or transverse serration. It is crisscross serrations. And usually we have a groove in the blade. There is a groove. Then these are the differences of this instrument from an artery forceps or hemostatic forceps. In hemostatic forceps, blade is almost equal to the shaft, but in needle holder, blade is much shorter than the shaft. The serrations in the blade of hemostatic forceps is transverse, but in case of needle holder, it is crisscrossed. And there is no groove in the blade of hemostatic forceps, but there is a longitudinal groove within the blade of needle holder. Then then you can understand the differences between needle holder and hemostatic forceps. Can you? Hello. Will you be able to find the differences between needle holder and hemostatic forceps?
Yes, sir.
Sure.
Yes, sir.
Okay. This is golden color, but don't get confused. Color is not a difference. It can be silver color or anything. Color is not a difference. The difference is the length of the blade, the serrations, and the groove. The needle holder. What is the use of needle holder? Anyone? Can you say?
To hold the needle during suturing.
Yeah, to hold the needle during suture. That is the use. Which needle we can hold? What type of needle is hold with needle holder?
Curved needle.
A straight needle or curved needle?
Curved needle.
Curved needle. We have to curved needle. We use needle holder. Then these are the common instruments. So far we have shown. Needle holder is also sterilized by autoclaving. Up to this, so far we have learned these instruments are used in almost all operations. The towel clip, the sponge holding forceps, the hemostatic forceps, the dissecting forceps, the blade, the tissue forceps, either one, the tissue forceps. These are particularly the Alice tissue forceps. These are the instrument is needed in almost all operations. Now come to other instrument we use for a specific purposes. This is a forceps. This is also the blade is carved. You see the blade is carved. And this forceps is stronger than the hemostatic forceps. Actually, this forceps is known as pedicle forceps. There are different types of pedicle forceps. The important thing is almost all the pedicle forceps, the blade is variously carved. This is a pedicle forceps. This is another type of pedicle forceps. You see the blade is carved in a different fashion. This is another type of pedicle forceps. You see in a different type of fashion. These all pedicle forceps. These pedicle forceps are used to hold, usually to hold the pedicle, such as the renal pedicle, the splenic pedicle, etc. to hold the pedicle. In the pedicle, we know there are artery, vessels, etc. There are other tissues. All can be held together. Therefore, it is stronger and heavier, and the curvature is allowed to apply in the deeper surfaces, such as spleen or kidney. We cannot use a straight forceps. This curvature allow us to hold these pedicles. Therefore, the pedicle forceps are used to hold the pedicle. To clamp the large vascular pedicle is a renal pedicle, etc. This is, obviously, this is seizure. Seizure is needed in almost all operations. This is seizure. Is There are two types of seizure. This seizure, you see the blade is almost equal to the shaft and it is stouter. This is another type of seizure. It is curved but otherwise same. This is another type of seizure. You see, here the blade is shorter than the shaft and it is finer. It is not that much broader, that much stronger. Then this seizure is known as dissecting seizure, and this seizure is known as cutting seizure. Then there are two types of seizure. One is cutting seizure, one is dissecting seizure. Cutting seizure, another name is Mayer's seizure. Actually, the original name is Mayer's seizure. We cannot remember the name of the gentleman who invented the seizure, and therefore we say it is cutting seizure. Actually, it is Mayer's seizure. Mayo is relatively easier to remember, but this is difficult to remember. Metzenbaum seizure. A German name, and you know the German names are difficult. Metzenbaum seizure. This is dissecting seizure. Then the differences between the two seizure, you see, this seizure is broader, is stronger, and this joint and the blade is almost equal to the shaft. And here the blade and joint is shorter than the shaft. It is finer. It is more delicate. The Metzenbaum seizure is used for delicate cutting. Actually, this is the seizure used for surgical use to cut the tissues such as intestine, to cut the other tissue, the peritoneum, etc. But cutting seizure is almost like normal seizure you use in day-to-day life. That is the cutting seizure, the Mayo seizure. We use to cut the tissue, cut the sutures, etc. To cut the end of the sutures after knotting and to cut the delicate, to cut the tough tissue such as the end of the tendon, etc. But Metzenbaum seizure or cutting, dissecting seizure we use for delicate tissue such as intestine, such as nerve, etc. This is another Metzenbaum seizure. You see how short the blade in comparison to the shaft. And this is a seizure which is used to cut the knot. Therefore, it is known as stitch cutting seizure or suture cutting seizure. When we cut the stitches, we use this seizure. It is known as stitch cutting seizure. You see, there is a small curved area at the end of one blade, and this narrow area allows to introduce it under the knot, and therefore we cut the knot after suturing. After 5, 7, or 10 days after suturing, we have to remove the knot, and in that case we use this suture. It is known as stitch cutting suture. There are different types of stitch cutting suture. The characteristic which define it as a stitch cutting suture is that the end of the suture is very narrow to allow it under the stitch or under the knot. There are different type of stitch cutting suture. Stitch cutting scissor. This is another. You see the end is very narrow. This is another. You see the end is narrow. These are all stitch cutting scissor. The common stitch cutting scissor we use in this hospital or in most of the hospital is this one. But other types of stitch cutting suture scissors are also very commonly used. This is one and this is one. Then this is stitch cutting scissors or suture cutting scissors. We use this scissor to remove the knot or stitches after healing the tissue. Okay. These are so far today. Then do you have any questions, anyone? Yeah. Yeah, we call it rough scissor and fine scissor. Actually, cutting scissor. The original name is Mayo scissor, but we call them cutting scissor or rough scissor. And medicine bound scissor, we call them dissecting scissor or fine scissor. Okay. Any other questions? If there is no questions, then this is the end of this session. Okay. Take few minutes and then Dr. Mustaq Hussain will come to start a new session. Okay. Thank you.